My name is Tanisha,
And my name is Khaja.
and we are Team Carebase.
Here comes our solution for an healthcare dashboard coming from a customer point of aspect. If we have an AI agents and then they're like in a call recording, if it's our AI agent talking to the customer ahead and customer calls AI agent, he tells his issue, this and that. So there are some difficulties where our AI agent can't hear it clearly, and there are some issues at the customer end also where he cannot understand what questions our AI agent proceeds to go on. So our solution, what it does means it transcribes what the user speaks, and clearly it generates a whole dashboard for our healthcare center with all details of the recent call logs from certain patient details, patient name, when did the patient call, what are the key symptoms of the patients, and what is the urgency level of the patient call. Coming on to the status of that, we go forward each by each and have an update about if the particular patient problem is solved, then we'll keep it as processed, else we'll keep it as pending one. On to our next part in the dashboard.
We have upload call, so we have two options. Either we can drag and drop an audio file, and we can even record it live. So right now I can show you by dragging dropping a file. Here is the demo file. I'll be processing the call. So it's uploaded, transcribing, extracting, and it is saving to database. After this, it will extract all the details and it will provide voice, AI voice, which will be explaining what the patient health concerns are and what measures should be taken.
So as it loads, I'd like to mention one point here. If the urgency level of the patient's symptoms and everything is more, so we have included Whisper, which will act as a transcribing one, and also we have included ElevenLabs, which is also a AI auto-generated urgency, letting us know about the urgency. That agent will let us know, okay, this is the higher emergency kind of requirement. Then that once we have that, we save it all to the database just to query it later from whole database. Like if our health center has multiple patients, let's say 200, 300, it'll be very hard to filter out certain patient. So
So here's the complete analysis. So these are the top extracted entities which were shared, and here is the follow-up. And here is the transcript which was recorded and the green transcript. These are the extracted medical entities. So the medication which were provided was ibuprofen, and there were no side effects reported.
and we also have urgency assessment. We also have an option for the database query where we can say, okay, what is this customer's actual need? And it'll be easier to quickly get the details and then we can plan accordingly.
Coming on to the call logs, we have the previous call logs, any file names if attached, or any recordings taken. Here is the structured data and the database similar to the one of the patient. Um, then we have alerts. It's the high urgency call alerts which require immediate attention. So here, as James Carter reported that the person was having severe lower pain, there was an alert.
And then we also have patients dashboard where their age, medications, confidence levels of how they explain their health situation in call, how many calls did they do, and on what date. Coming on to the database part of this and how it meets the requirements or the challenge specified by AutoDB and Care Caller is that we do save our database, but a structured intelligence query system is integrated in along with AutoDB.
Thank you.